And welcome back to Idaho Today. Congestive heart failure is a chronic progressive condition that affects the heart's ability to pump blood around the body. But the ability to recognize heart failure isn't as easy as you might think. So we had the chance to talk with Dr. Sophia Earhart to learn more about how we can all get ahead of heart failure and address it quickly.
Well, can you share a little bit about your background and specialty?
Sure. Yeah, I'm an advanced heart failure and transplant cardiologist. I moved from the Northwest with my husband, who's a cardiac surgeon. We came to St. Al's because they supported our vision of bringing the whole spectrum of advanced heart failure therapies to Boise and Idaho in general.
And so it's been probably quite the experience for you. Can you share, as a heart failure expert, can you explain what heart failure actually is? I know people have seen it in the news, but what is actually heart failure?
Yeah, heart failure, great question, is when the heart is unable to meet the demands of the body. And so what does that really mean? There's different types of heart failure, and the disease can manifest along a large spectrum of mild limitations when people may get short of breath with exercise versus very severe limitations where people may get short of breath even at rest or getting dressed. So heart failure is caused by a broad spectrum of conditions, but the common ones are impaired blood flow to the heart, high blood pressure, and there's lots we can do to prevent heart failure, like taking care of our bodies, eating healthy, maintaining a healthy weight, regular physical activity, controlling our blood pressure and other things. When your heart is unable to meet the demands of the body, then you can be short of breath, you can have fluid backup. Some people have really low energy. So it is a condition that really affects the daily lives of people.
So someone gets diagnosed with heart failure, what would their next steps be?
Yeah, so by far the majority of heart failure patients are cared for by primary care docs and general cardiologists. As an advanced heart failure physician, I usually see patients who are hospitalized multiple times or people who are still feeling very limited despite medications. So I would say, follow the instructions of your doctor, take your medications. Medications in heart failure have been shown to improve survival and help improve quality of life as well. But if people are feeling worse despite medications, that's a time they may want to see someone like myself with advanced heart failure to see what options there are for patients.
So you came from a different area of the Northwest. How crucial is it, important is it that St. Alphonsus has such a high-level facility and program like this? Yeah,
absolutely essential. So heart failure is a team sport, and so it takes a lot of expertise to build a heart failure program and to have both the breadth and depth to take care of patients. But every patient should be empowered to know their options. And St. Alphonsus is committed to taking care of the sickest of sick patients and treating the whole spectrum of heart failure. So some patients may not even know that ventricular assist device therapy may help them live longer, or that transplant.
I didn't know that, that's for sure.
may be an option.
Yeah.
So, and also some patients may not know the new therapies for their heart condition. I'm very committed to clinical trials. I'm also an assistant professor at University of Utah, so I'm connected with the broader community.
So there are advancements in looking at treatment for heart failure, right?
Heart failure has changed dramatically over the last decade.
Okay.
There's new therapies now that weren't there before, and the therapies that were there before are even better now. And that's another reason why I love this field, because it's very exciting.
Are there misconceptions out there that people should be aware of when it comes to heart failure?
Yeah, I would say for sure. I would say that when people hear the word heart failure, it can be overwhelming.
Oh, sure. Yeah, I would think so. Yeah.
Yeah, it doesn't mean that the heart is about to stop working.
Okay.
I like to think of myself as a heart recovery physician. The heart can recover, and medications can make a huge difference. And so it's about knowing the right therapy for the right person at the right time.
Okay.
So I would say that's a major misconception, that the heart may not recover. It's just, it's not working as efficiently as it could, but with the right therapy or replacement therapy, there's lots of options.
It needs some help, right? It needs to, it's not, I think when you think of failure, you think, well, there's no way back, but you're saying, no, just because you have heart failure doesn't, I mean, we can get your heart back to where it needs to be.
Yeah, it's a treatable condition.
Oh, that's wonderful. Where can people go for more information? I know there's a lot of people watching saying, okay, this fits my description, or maybe someone I know. Where can people go for more info?
Yeah, with regard to what we're we're building at St. Alphonsus, I would recommend going to the website, stalphonsus.org, and put in the search heart failure. You'll be able to meet our team there. We have an amazing team. We collaborate with cardiothoracic surgery, structural cardiology, and we have really excellent pharmacists and nurse coordinators as well. So we
wonderful. Yeah.
Keep a close eye on people.
I love it. I love it. Thank you for everything you do with St. Alphonsus and obviously treating heart failure. So thank you so much. We'll have more Idaho Today coming up after the break.